Over the past 20 years, the adjuvant treatments that have been used for patients with high-risk melanoma were high-dose interferon, then PEG interferon, and then high-dose ipilimumab. And we constantly had arguments about whether these should be used or not, and in which patients. And in truth, none of the treatments were effective enough or tolerable enough to justify their widespread use, particularly in the era recently where there were more effective systemic treatments for stage 4 disease and were actually being used in the adjuvant setting. And so we've been waiting for the data to come out for the treatments that we've been using in the stage 4 setting in the adjuvant patients. And we saw at ESMO this year 3 studies reported. One, the BRIM8 study looking at vemurafenib in the adjuvant setting. Second, the COMBI-AD study looking at dabrafenib-trametinib in the adjuvant setting compared to placebo, the last 2 in patients with BRAF mutant melanoma. And finally, the nivolumab study looking at nivolumab versus high-dose IPI in patients with stage 3B, 3C, and resected stage 4. And essentially, all were positive, although the vemurafenib study was designed in a way that it had to be interpreted as negative. But in the stage 3B, 3A, and 2C population, the vemurafenib was better than placebo.